Experience is an important factor. Pleasurable sexual experience can lead to sexual desire. Clitorial biothesiometry can generate pleasurable sexual experience. Once again, I am telling clitorial biothesiometry can generate pleasurable sexual experience. Very good morning. See, my topic is penile and clitorial biothesiometry. From the beginning, I want to declare that clitorial biothesiometry, each and everyone is asking where this machine is available. At present, it is not available. I have made it, and I am practicing it. That is an anecdotal method that I will explain later. Then, penile erection can be compared to a three-legged stool. That means vascular supply, neuronal supply, and hormonal supply. Suppose this balance is gone, erection will not take place. So we can investigate vascular problems, that is penile Doppler study, investigation for hormonal blood investigations can be done. What about neuronal study? Then investigations are there. The neuronal problems, CT, MRI, neural conduction study, all these things are expensive. Penile sensory and motor innervations are heavily dependent on the adequate neurological health. So in office electrophysiological tests that measure somatosensory evoked potentials are available to assess neurological capacity in men presenting with sexual dysfunction. Valuable, complex and costly, and it is uncomfortable also. Penile biothesiometry became increasingly popular in the early 1990s and showed promise as a rapid office-based, non-invasive and means of evaluating and sensory capacity. Then, biothesiometry is used in diagnostics of peripheral neuropathies with impaired vibratory perception threshold, mainly diabetology and neurology. In almost all diabetologists are using this equipment for their neurological evaluation. That means peripheral neuropathy can be diagnosed by this method, not for penile this thing. Then, biothesiometry device consists of a handheld probe that is connected to a stationary amplifier, which contains an intensity dial and an analog frequency meter. That is shown here. Then, penile vibratory innervation is distinct from other somatic modalities such as pain, temperature, and proprioception. Vibration as a penile stimulus is positively correlated with the sexual response because of the vibratory nerves travel with the nerves of penile sexual sensitivity. That method we are utilizing here. Then, biothesiometry allows for the assessment of penile vibratory sensitivity. It has been proposed as a clinically useful means of assessing penile sexual activity. Then, the effectiveness of biothesiometry in detecting sensory neuropathy has not been fully established. This is in part due to a lack of standard units, measurement in the literature, where some studies use hertz and others use voltage and everything. Then furthermore, no definitive procedural protocol exists, which makes it difficult to compare results across different studies. That is from the different centers. Biothesiometry allows evaluation of penile vibratory sensitivity and can be used as a non-invasive rapid surrogate test for penile sexual sensitivity. However, no standardized measurement exists. Then a nerve conduction test is costly, and that I am not going to explain it. There was no consistent methodology for biothesiometry due to difference in the how biothesiometry was performed. That means if it is measured from one center, we will be getting 60, other center it may be 40. Then these three research fellows made a standard. How it is, they introduced a novel biothesiometry parameter, the PSR, penile sensitivity rate in an effort to address these limitations. Because of the PSR, it is a ratio between vibrotactile thresholds at different points on the body. Then, it overcomes the validity of biothesiometry to significant intra and individual variability in vibrotactile thresholds, particularly between individuals within a single individual across a time. The units get cancelled and it is a unitless value. Then how does it come? They used vibrotactile thresholds at additional peripheral locations on the body, such as index finger in finalized PSR GF equation to establish an internal control and reduce the variability of measurements. Given that all patients undergoing biothesiometry in study cohort presented for evaluation of sexual dysfunction, including erectile dysfunction, Peyronie's disease, ejaculatory dysfunction, or concern with penile sensitivity. Then, the absolute value for the glands should be considered when interpreting the penile sensitivity rate. Because of a particularly low value for the index finger, may artificially increase the PSRGN by finger. Then, turn off the biothesiometer, patient in supine position, penis in the flaccid state. Place the probe in contact with the olar part of the index finger. Continue the probe skin contact with in 90-degree angle. Turn on the biothesiometer. Increase the vibratory frequency in a continuous fashion. Record the frequency when the patient verbalizes perception of the stimuli. Increase the frequency and confirm that the signal intensity is perceived as getting stronger. Reduce the frequency progressively and take the average of it. See, finger, glands, and thigh. These three things we are taking, then we are calculating it in such a way, PSR by GF, that is mean glands per left and right, mean index finger left and right. Then PSR, GSS by foot. These three criteria it can be taken. From that, we will get a clear-cut idea how this thing, biothesiometer can be used. Then healthy. Men with no sensory complaints have a threshold vibratory detection in the index finger 6 to 8, whereas in glands 8 to 10. Normally, I get more, for erectile dysfunction, when I am checking, it is more than 15. That means that they are having neurological deficit. Healthy men, it is PSR by GF is 1.5 and PSR by GS by F is 1.7. Then the other thing is by foot it comes 0.2. Glands threshold less than 12 is good and index finger less than 10 is good. Okay. Then clitorial biothesiometry. So penile biothesiometry is a diagnostic method, but clitorial biothesiometry is a diagnostic as well as therapeutic method. We have done it in our institution. It is an anecdotal study. We done it with our patients. Clitorial biothesiometry is a diagnostic as well as therapeutic equipment. Low sexual drive, sexual arousal disorder, orgasmic disorder can be diagnosed and treated by clitorial biothesiometry. Dr. T.S.S. Rao told that each and every woman can be evoked to orgasm. That means the anorgasmic people. That means it cannot be done by partner. If it cannot be done by the partner, biothesiometer can be used as a diagnostic as well as therapeutic equipment. Then a normal vibrator will be having only vibration sense. Here it can be graded. That means from 100 to 200, 150, 200, 250. Some female patients will say that when it reaches to 250, they are getting orgasm. Then, or they will be getting intolerance. Genital tactile stimulation is regarded as a precursor of sexual arousal and a recognized initiator of central nervous system arousal. Specific afferent neuronal pathway transits sensory stimuli to arousal beginning at the epithelial level on the clitoris and following the course of arousal stimuli through the central nervous system. Limited knowledge exists of the pathway from the cutaneous receptors of nerves originating in the epithelial tissue of the clitoris and continuing the spinal cord afferents. This Eros therapy system was using to diagnosing female sexual dysfunction, but it is of practically no value at all. We have two iterations. One, pleasure point. When we are keeping this clitorial biothesiometry, there is a probe, patient will say that I am feeling comfortable. That means pleasure is there. Then, if you are increasing the this thing, hertz or voltage, at a point, patient will say that intolerance is there. Then before the intolerance, it is the orgasmic point. Then what is the normal value of pleasure point and intolerance points? Is it age related? Which conditions and diseases affect these points? How does it affect in different phases of menstrual period and menopause? To find the normal value, we have to conduct a study with the normal subjects. It is impossible. That means conducting a clitorial biothesiometry study with the normal subjects, we will not get volunteers and everything. That's why it's a research subject. We can do it. Then, causes of FSD. Organic elements such as hormonal, neuronal, and vascular. Psychosocial issues. Appropriate female sexual function requires delicate balance of neurotransmitters such as dopamine for desire and epinephrine, norepinephrine, and serotonin for arousal and orgasm. Disorders and medications that disrupt these elements may lead to FSD. It is better to do hormonal evaluations and other investigations before going to clitorial biothesiometry. Finally, experience is an important factor. Pleasurable sexual experience can lead to sexual desire. Clitorial biothesiometry can generate pleasurable sexual experience. Once again, I am telling clitorial biothesiometry can generate pleasurable sexual experience. That means some male partner brings their partner, female partner is not having orgasm at all. Then we tried with this clitorial biothesiometer from our lab, that means our investigation center, they got orgasm and sexual experience, that means orgasmic experience. In our study, by increasing the vibratory frequency to a high level, FSD patients will experience pleasure sensation at a particular point. Keeping the probe above this level results in sexual desire. Yeah, this slide you know, I am not going to explain more. Then, orgasmic disorder. Method with the clitorial biothesiometry. Increase the vibratory sensory in a continuous fashion till the point of intolerance. Reduce the frequency to 2 to 5. Then the time factors. Keep the probe for 1 minute. Increase the frequency to 2 points per minute. Keeping the probe for 10 minutes, most of the patients attain orgasm. That is our own experience. It is not available in any book or internet. We have managed it. Management of lack of interest with the clitorial biothesiometry. Stimulating the clitoris with the probe of the biothesiometer is the method. Gradually increase the frequency. Find the point where the sexual stimulation takes place. Then, continuously increase the frequency. Few subjects can attain orgasm. This experience can induce spontaneous sexual urge. Management of vaginismus. With the clitorial biothesiometer, place the probe in contact with the clitoris. Continuous probe skin contact increases the vibratory frequency in a continuous fashion. Let it overcome pleasure point. When it reaches the intolerance points, reduce it to 5 points. Then continue the stimulation. When the patient attains the orgasm, slip the probe into the vagina. That I will show in the video. Then, videos, play the video. Keeping the probe at the clitoris. Then increasing the heads from the machine. Yeah, and stimulating it, stimulating the clitoris. She will be getting orgasm. Then we will be inserting into the vagina. Yeah. This can be applied to the vaginismus patient. She is not having any vaginismus. This is the method. What's the question, sir?
Suppose the individual is complaining of I'm not getting orgasm. Should the husband has to carry the biothesiometer or he has to be brought to the institution?
No, they have to come to the institution and it is in the initial stage, clitorial biothesiometry.
Then it will be okay. What about the husband cannot elicit ever?
Husband can stimulate, then we have to give him this thing, the mission. No, it is in the beginning stage only. That means, cost comes about, I think normal biothesiometry comes about 35 to 50,000. No, it is, we cannot say it is modified vibrator. Pardon? Yeah, therapeutic purpose we can use. What Amit Mutta, it is not vibrator. No, vibrator is having vibration only. Here actually that means it starts from the 0 to 500. Okay. No, if peripheral neuropathy also, diabetologists are doing this biothesiometry. In that biothesiometry, penile biothesiometry was started at 1990. Now I am working on this clitorial biothesiometry to make it as a treatment method for anorgasmia and lack of interest, as well as for the vaginismus. Regarding vaginismus, I have successful rate in it. Because of clitoris is this thing. Yeah.
The probe is same for the male and female?
Pardon?
Probe.
No. Probe I have. Now we are manufacturing the probes. That means like dilators. There is small one, bigger one, like that.
Now for clitoral and male, same?
Yeah, somewhat same. Some difference is there. Somewhat same, difference is there. So listen to me. It is in the initial stage. We are doing research on it. Anecdotal research. Any other questions? I will answer now. Regarding the cost, I will say, if it is manufactured in the proper way, it will come out about 75,000 or something only. Less than that it will be. But for an ordinary biothesiometer, it costs about 35 to 50,000. For this probe will be changing. ISRM is working on that. Let us.
What is the difference?
No, vibrator only one thing.
What is the difference between vibrator and this biothesiometer?
It cannot be increased or
The
decreased.
purpose are both there to reach the orgasm.
Pardon?
Purpose of the vibrator is to reach the orgasm, and purpose of this is also to reach the orgasm.
I didn't.
So why can't we?
Sir, this is vibrator is crude. This is refined.
Calculations are there. Mission is there. That means how? Degree.
There's a clitoral stimulation as well as along with that the vaginismus is being cured by inserting the same probe into the vagina. This is what I feel.
So.
More vaginismus or
No. Assignment, that I will explain. When the clitoris is stimulated, that means more and more stimulation occurs, and she will be coming into the orgasmic mode, and phobia will be reduced. Vaginismus is nothing but a phobia, penetration phobia. When she is sexually active, that penetration phobia is being reduced. That's why we are using this thing.
Yes, a neurophysiological. It will give autodilation.
See, vaginismus patient is always having sexual urge. They are having sexual urge. It is not sexual aversion disorder. They are having phobia. They are afraid of that thing. That much only. Yeah, more sensitivity, more stimulation takes place. The vaginous patients do masturbation in the clitoris, but they will not penetrate in the vagina. That we must understand. Okay, now the time is over. Yeah, yes. Yeah, it can be checked. Male and female, the same probe will be changed. Probe is, cost is same.
Thank you, Dr. Ajayan.
Then no. No,
Sir.
no. Once she attained the orgasm, Ajay how to take it.
Sir, one question, sir.
Yeah, yeah. 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 Okay. Thanks.
Sir, excuse me, sir.
Thank you.
Yeah, this sir. Dr. Dipan, sir. Sir, as you have shown in the meter, this is biothesiometer. So, any reading comes so that we can measure
Yeah.
the capacity of the female or male, how much they have the potentiality. Is there any meter or any graph or any result coming out of this
Yeah,
medicine?
it is there.
Okay.
It is there.
Okay.
I request Dr. Alka ma'am to felicitate Dr. Ajayan.